And Dr. Jane Bolin is with the Texas A&M Health Science Center as an associate professor and also is the director of the Southwest Rural Health Research Center, which means you have a large business card, obviously, with all the titles. You've been watching the rollout. Dr. Bolin, what's your reaction, I guess, to today's news that they're going to have a little bit of an extension?
Well, I think that's a good thing for healthcare consumers. This has been a bit of a process for individuals trying to enroll in healthcare and trying to figure out how to get to healthcare.gov. And what we learned today through the news announcement by the White House is that individuals who are in the system by March 31st will be helped to enroll by experts that can show them how to become enrolled in health insurance. So the White House has shown that they're willing to extend the deadline, and in addition to the other benefits of the Affordable Care Act, I think that's a very reasonable thing.
Sure. There's really been a lot of confusion, I feel like, just on the law itself, but just compounded by the fact that this rollout has been a little bit sketchy. In fact, I think CompuWare did a survey this morning, or just came out with a survey this morning saying, compared to other private insurance websites, healthcare.gov is running immensely slowly. The federal government says, we're not so sure about your testing compared to what we are seeing, but still, there are just question marks abound about this website.
They certainly have had their bumps. They have worked out a number of the glitches in the system, and overall, I think many of the aspects that they wanted to have up and running in time to get as many people enrolled as possible have been worked out. Really the goals of the healthcare.gov and Affordable Care Act are really to enroll as many individuals as possible. It's an estimated 17% of the overall nation is uninsured, 25% of Texans are uninsured.
And this area really kind of falls into line. Health for all, I should say, has said about 25% of Brazos Valley residents are uninsured at this point, which is a pretty staggering number. Is there any indication, it seems like Texas has kind of been slow in signing up. Have you seen numbers at all? Have you seen indications at all about how Texans are reacting to this opportunity?
Well, because Texas is one of those states that opted out of the health insurance exchange, it's been up to individuals themselves to go find the healthcare.gov website and to enroll. But there are plenty of community organizations willing to help. For example, here in the Brazos Valley, there are several community health organizations, FQHCs, community health clinics that are willing to help individuals get enrolled.
So once we get past this deadline, and again, it's been extended, once you start the process, you can still continue it past that March 31st. If you are not underway, that penalty starts to go into effect. It's $80-something, if I remember correctly?
Right. If an individual hasn't tried to enroll by March 31st, then they have to wait an additional period of time, 6 months, in order to try to enroll again, and there will be a penalty to be paid on their taxes.
Sure, and there's been all sorts of questions about whether the penalty is enough, because right now it's that minor amount and doesn't seem like too much of a penalty compared to what you would have to pay for health insurance.
Correct. There's a penalty, but in addition, if they have any hospital or medical care bills, they're still paying those completely out of pocket without the benefit of insurance.
For those who, though, do want to get covered and maybe are wary about the website, there is, I guess, a telephone number that is being offered up.
That's correct. There is a number that will be on the KBTX website. The number is 1-877-968-6518.
Okay, and it's on your screen as well right there, 877-968-6518 for more information if for some reason, and it apparently has not been working on the healthcare website. Might be slow, might not be working, but the phone number, and there are people on there at all times. What message do you want to put across as somebody who has really studied this website and who, of course, is in the medical profession?
Well, in my opinion, after studying it, I think they have worked out a lot of the glitches in the website. This act is intended to address the exclusions of individuals who had pre-existing conditions. It's intended to allow parents to continue to cover their children up to age 26 on their own health insurance policy, and it also provides, I think, greater opportunities for individuals who are lower income to have access to some form of health care.
Dr. Bolin, thank you very much for the time. We very much appreciate your expertise.